So welcome to another recorded session of your nursing seminar. So for this video, I will discuss perioperative nursing. So while I discuss, I hope that you jot some notes so that you'll be able to have your own copy, your own notes about perioperative nursing. Let's start. Okay, so what is perioperative nursing? So it is used to describe the nursing care provided in the total surgical experience of the patient. Okay, so it begins when the patient is informed of the need for surgery. Okay, so sorry pa lang niya daan sa doktor na kailangan siya operahan. That is the start of your perioperative period. So it includes the surgical procedure, the recovery, and then it continues with the discharge. And it ends when the patient achieves his or her optimal level of post-surgical function. So that is when your perioperative begins. Okay, mag-discuss na sila sa doctor nga kailangan siya mag-perform ng surgery. And then sa end, nga no, achieve na sa patient iyang optimal level of function. And it has three phases or stages. Letter A, we have preoperative, B, intraoperative, and C, postoperative period. So that composes your perioperative nursing. Okay, so there are indications for surgery, and we have the CARD acronyms. So C stands for correction of defects. Letter A, alteration of form. Letter R, restoration of function. And letter D, diagnosis and treatment. So those are your indications for surgery. And please remember the CARD acronym for this one. Next, we have different settings for surgery. We have inpatient and outpatient. So when you say inpatient, so that refers patients inside the hospital. Meanwhile, for the outpatient settings, you have your hospital-based ambulatory surgical centers, freestanding surgical centers. We have the physician's offices, no, pag very minor surgery lang. So they can perform it within their clinic. And lastly, we have the ambulatory care centers. So those are your settings for surgery. And the next one, we have classifications of surgery. We have the pure acronym for this one. Letter P, we have the purpose or the reason. Okay, nga magpa-surgery ang patient. Then we have the urgency, or urgently iyahang case. Then we have letter R, risk, or the degree of risk of the surgery. And letter E is the extent, kung asa taman ang operahan sa patient. So those are your pure classification of surgery. Next, we have the purposes of surgery. So letter A, we have diagnostic. So it can establish whether a person has a particular illness, disease, or condition. Diagnostic surgery may be recommended when the person has signs that something may be wrong. Okay, so that's why i-diagnose siya. Maybe there's something wrong inside the body of your patient. For example, breast biopsy. Okay, then we have exploratory laparotomy, or XLAP for short. So that is, or those are your examples of diagnostic surgery. Letter B, we have the ablative. It is to remove all of the visible tumor along with a clear margin of healthy tissue surrounding the tumor. So basically, ablative refers to like removing abnormal cells, abnormal tissue cells within your body. For example, is your mastectomy, piko ng inyohang breast, no, if it is kanang if it is possible that there is cancer cells within your breast, and also hysterectomy, removal of your uterus. So those are example of ablative surgery. Next, we have the palliative surgery. It is designed to help relieve symptoms of incurable diseases. So for example, for example, you have colostomy or nerve root resection. Okay, the palliative is performed with the intent of improving quality life or relieving symptoms caused by advanced disease. So palliative care, meaning ang iyahang goal ana is to make the patient comfortable as possible no, within sa iyahang life. Okay, usually yan sa palliative care is kana mga end stage na like sa like patients who has cancer. So usually ang management ana is palliative care, palliative management na lang. Next one, we have letter D, cosmetic. It is a unique discipline of medicine focused on enhancing the appearance through surgical and medical techniques. Cosmetic surgery can be performed on all areas of the head, the neck, the body, because it is treated, uh, the areas function properly but lack aesthetic appeal, cosmetic surgery, and it is elective. For example, you have your breast augmentation, rhinoplasty, liposuction. So those are your example of cosmetic procedure. Then last one, we have the reconstructive plastic surgery. It is done to correct facial and body abnormalities caused by birth defects, injury, disease, or even aging. Usually, the goal of reconstructive plastic surgery is to improve your body function. So for example, we have the cleft lip and palate, okay? Breast reconstruction following a lumpectomy or mastectomy for breast cancer. Okay, so gikuan na ayahang breast, no? Gikuan for example og tumor. So kailangan i-reconstruct ang breast so that ma-enhance pod ang ang physical appearance pod sa patient. And then we also have the reconstructive surgery after burn injuries. Okay, so that's it. Those are your purposes of surgery. Okay, now we have the according to urgency surgery. So we have different classifications. We have emergent, urgent, required, elective, and optional. So the first classification is we have the emergent. So the patient requires immediate attention, and if it is life-threatening condition. Okay, so emergency gid kaayo siya, immediate attention because there is a risk sa iyahang life sa patient. That's why the surgery must be performed immediately. So please put it into your minds nga basta emergent gid siya, immediate gid ang surgery ana, okay? Indications for surgery, it must be without delay. Like Inchageda din, surgery dayon. So examples, there is a severe bleeding, gunshot or stab wounds, and then fractured skull. Those are your examples for emergent surgery. Next one, we have the urgent, okay? Or the other term is imperative, but the very common term is the urgent surgery. So the patient requires prompt attention. And the indication is that it can be done within 24 to 30 hours. And examples are if you have kidney or ureteral stones. Okay? So those are your examples of your urgent nga surgery. Again, if it's emergent, immediate nga surgery. If it is urgent, it requires surgery but pwede ra siya ma-delay gamay. Okay? Next, required. The patient needs to have surgery. Indication for this one, it must be planned within a few weeks or months. Depende sa pag check up ninyo sa doctor. For example, you have your cataract surgery and your thyroid surgery as well. Next one, you have your elective surgery. So the patient should have surgery. Indication for this one, failure to have surgery is not catastrophic. Okay, for example, you have your repair of scar or vaginal repair. So it is an elective surgery. Usually in the OR, pag nakaschedule siya, muna siyang ginatawag nga elective. Usually, ginapa-schedule siya weeks before this surgery. or even months. Okay, so that is what you call elective surgery. Nakaschedule siya daan. Schedule good siya during that time siya operahan. Okay, next one, you have your optional. So, it is the patient's decision kung magpa-opera siya or dili. It is her or his personal preference. For example, cosmetic surgery. And also, another example is circumcision. Okay, so depende sa parents if ihabang ipa-circumcise iyahang uh, anak or dili. Okay, so it is there, right? So that's it. That is why it is called optional surgery. So the surgery is classified either major or minor surgery. So when you say major surgery, it is more extensive resection is done. Okay, so dako kayo ang area nga ginaoperahan. It causes the damage to the tissues. Of course, di ba, kay extensive man gyud ang pag-perform sa surgery during major operation. And there is a high risk of infection. Again, kay dako man ang gioperahan sa patient, dako ang opening, so there is a high risk of infection sa patient. Then, last one, there is an extended recovery period. So, again, if dako ang gioperahan sa patient, dako ang incision, so grabe kayo ang perform og surgery sa patient. And of course, there is an extended recovery period for the patient. But when you say minor, there's just small incisions that are made, no extensive damage to the tissues. The risk of infection is low because of course there is small incisions sa mano. And then the recovery time is shorter as well. And then it is usually the doctor who will decide if it's a major surgery or a minor surgery. It is their preference na. And then they talk to the patient if it is okay, no, nga mananghid sila nga they have to perform it, for example, in a major surgical way. Kay dili ra siya madala og minor. Kay kailangan siya a major surgery. So, for example, sa major, we have the exploratory laparotomy or XLAP. And then we have the cesarean section as well. And then for minor surgery, we have incision and drainage. So that is your example of your minor surgery. Okay, now we have the extent of surgery. So we have two types. We have simple and radical type of surgery. So usually, ang major na example niya ani is the breast removal or mastectomy. So when you say simple mastectomy, it removes the breast tissue, no, nipples, and the areola as well, and the skin, but not all the lymph nodes. So, dili apil ang lusay pagkuha during the simple mastectomy. However, on your radical mastectomy, you remove the entire breast, including the breast tissue, the skin, the areola, the nipple, and most of all the lymph nodes, axillary lymph nodes. Apilon ang lusay sa ilok pagkuha. Usually, pag radical na gani na siya, there's a possibility nga there's a cancer cells no sa inyong breast. So that's why kailangan tanggalon ang mga lusay para dili na siya na mag-scatter ang cancer cells sa breast area. So that is your simple and radical mastectomy. Okay, so now we're on the three phases of perioperative nursing. We have the pre-op, intra-op, and post-operative phase. Now let us start with. Okay, so we are now in the preoperative phase. This is the first phase of your perioperative nursing. Let us tackle first what are the common nursing diagnoses in this phase. So we have knowledge deficit and anxiety. Of course, now your patient will be really anxious and also afraid not to undergo surgery. So anxiety differs from fear, which is defined as dread of something specific. And then the fearful patient can identify the focus of his or her fear. Okay, so of course, kinsa man gani, kinsa may malipay nga mag-undergo surgery, no? maybe except for cosmetic procedures. But other than that, it is a very threatening and fearful situation. And then fear may be related to the surgical intervention, the surgical outcome. So, maayo ba ka ko or dili? Yan ang mga different nga thinking sa itong mga patient. Ang anesthesia, si effects sa anesthesia sa atong body, and also the impact of surgery on our lifestyle, the loss of control, the pain, or even death. It is more common for patients to be anxious than fearful, of course. Anticipatory grieving is another related preoperative nursing diagnosis. It is related to possible changes in the body image. Here, for example, if if your patient will undergo BKA, no? Below knee amputation, so mawalaan siyang tiil. So that is a very traumatic experience for the patient. And then there is also increased heart and respiratory rates and elevated blood pressure, which is can be sign of anxiety or fear as well. So that's why before sa OR, uh, for example sa mga patients, sa mga tigulang usually who undergo cataract surgery, before sila madto sa operating room, okay ra na ilang vital signs, especially ito yung BP, no? Pag naana sa ER, ginakuhaan mo na sila vital signs sa ER. And before sila isa ka sa operating room, normal pa sila, kalmara na sila. Pagsulod sa operating room, ginabutang na naman sila sa isa ka area, sa waiting area. So kami po OR nurses, we also get their vital signs. Kaya kana man namong receive nga vital signs kung kami ang mag-perform. Okay, so pag BP na ganyan mo na sila, tag-as rin kay BP. 150/80, 160/100. Grabe good kay katag-as. You know what? It's because they're afraid. They're very anxious and stressed sila sa situation nga operahanan sila sa ilahang mata. Cataract because usually patients na nakasama ang cataract ng mga patients, cataract surgery patients. So that's why your fear, your anger, your anxiousness really affects your body, especially your vital signs. Dira siya mo appear kay bali ang yung kahadlok kay mga taas ang BP. So that is why as nurses it is very important that you empathize to your patient, if they are afraid, if they are anxious. So it is important nga you let them know that they are in good hands, that you will do your best as nurses in order to accommodate their needs, no, their fears, their concerns. Inyo do ginang i-address tanan. Kung giuhaw ang patient, ma'am, pwede ko makainom ng tubig before ko magpa-opera, or ma'am, pwede ko mangihi before ko magpa-opera. So, to let them do it, of course. Then, usually sa isa man na sila ka grupo, puro mga isa ka room, no, puro mga tigulang, sa mga chika-chika rin ang mga older patients na with each other para ma-release nila ilahang tension, ilahang anxiousness. So, magchika-chika na sila dito while waiting sa ilang turn nga maoperahan. And then, a patient who is nervous may be not be able to concentrate or retain any information. So, of course, that's why kailangan gid ninyo ipakalma yung patient. Kukulbaan na gid ka siya, ipa-breathe in, breathe out. Deep breathing exercises. Then, para makasabot sa ng deep breathing exercises. So, na uban patient, di na nakasabot, no? Simple English na sila kasabot. So, you instruct them in their vernacular and you breathe together with the patient. You demonstrate to them how to do the proper breathing exercises. Then the desired outcome. So the desired outcome related to anxiety is that anxiety and fear will be lessened through increased knowledge and the ability to express feelings about the surgical intervention. It is important to assess readiness to learn because providing more information than the patient desires or can handle can exacerbate anxiety. Okay, so dili nimo ignon tanan nga, ma'am, May possibility ani nga dako kaayo ang blood loss sa imo, gabi ang dugo-dugo ani ma'am. So please, you tell your patient there is a possibility of a minimal blood loss. Okay, but rest assured, ma'am, that the doctors are here to guard you always, to guard you all the time, so that you will be safe. The procedure, the surgery will be smooth, and there will be no undesired outcomes. Okay, so dapat kalma lang gid mo magstorya sa inyong patient. Then the following nursing interventions are ways to address anxiety and fear. So first of all, you have to listen attentively. Okay, so you let the patient talk, you let the patient express his or her fear, their anxiousness. Okay, just let them talk, let them express what they feel. Next, you provide information as needed and as desired. So providing information that the patient does not wish to know can increase the patient's anxiety. Okay, so there is a limitation kung sa inyo dapat ignan sa inyong patient. And again, the doctor will be the one who will explain about the surgery good. Okay, ikaw, your role as a nurse is to what you will do as a nurse sa imong nursing interventions para sa ilaha. O ikabala ka ma'am, naara ko diri sa kilid para magbantay sa imuha. Kung gitugnaw ka ma'am, ini lang mi ma'am kay dungagan ka na habol or kuan baka pwede niyo mabuhat para sa patient. Ini lang ko ma'am basin um, kung for example minor surgery, kung ma'am giuhaw ka ma'am, pwede ra narami water dito ma'am, pwede ka na ko ma-offer ng water. Okay, because di naman kailangan mag-NPO ang patient if it's minor surgery. Okay, so mga things like that, no, you offer your patient the best that you can, and then dili ka dapat daghan ka istorya nga puro sayop sa imong patient. Okay, so less talk, less mistake, ano na siya. Then solicit the patient's description of anxiety or fear. So let the patient express and then describe sige diyang kadlukan, asa siya anxious, okay? Then you provide emotional support and reassurance as well. Another desired outcome is that the related to a knowledge deficit is that the patient will demonstrate knowledge of the physiologic and psychological responses to surgery. So the following interventions are essential to promote patient safety, assess knowledge, and address any knowledge deficits. First is you have to confirm the patient's identity. Okay, so you need to make sure that it is the correct patient. So in order to do that, you need to let the patient state his or her name, okay, or other information, and as well as you need to check the name tag as well. And then verify the surgical site and procedure. Verify the patient's consent for surgery if napirmahan ba. Solicit the patient's perception of the planned procedure if um, nakabalo na ba ang patient kung sa buhaton sa iyaha. Then solicit the patient's questions about the surgery. So you encourage the patient to ask more questions so that mapanatag ra iyang loob. And then identify the patient's learning needs as well as readiness and ability to learn. Okay, so if your patient is a child, then you have to talk to the child in a child manner as well. Okay, then of course you need to include the parents or the guardian of the child, if patient inyong child. You also need to describe what the patient will experience as well. Okay, so for example, ma'am kanang bugnaw ra ba sa operating room ma'am, but rest assured nga naarami like warm blanket, thermal blanket para to keep you comfortable as much as possible. Okay, ina ninyo pagkuan sa patient. Then explain the procedure that must be followed post-operatively upon discharge. So especially for critical patients who will be discharged on the day of the surgery, which limits the time available for teaching. So in here na uban procedure no nga pwede ra sila makagawas within the day. Okay, na mga it's either minor surgery o nakoy major surgery, like for example kanang okay, laparoscopic cholecystectomy. So within the day raman na sila. Kay gamay raman incisions ana no. So gamay ra imong time nga pag explain sa like sa health teachings. Okay? So that's why as much as possible ma-explain na ang patient before gid sa surgery, especially the health teachings. Unsa iyang buhaton after sa surgery. Okay? Then you need to provide information with consideration for the patient's level of understanding, the ability to comprehend. Of course, if kasabot pa inyong patient kung in English mo, if dili gani mas maayo if sa mother tongue na lang i-istorya. Especially if naman sa public setting. And then desire for information. If gusto pagin mo na inyong patient, na pa siya yung mga concerns, then you address them accordingly. And then you have to respect also the culture and the religious beliefs of our patients as well. And then refer to the patient's medical concerns to the surgeon. You need to relay any concerns, no, medical concerns to the surgeon. Okay, if medical na gani istoryan and medical na istoryan, then that's the job na of the doctor to explain well. Okay. Then solicit feedback regarding perioperative procedures. Okay. So you always need to ask feedback sa patient if nakasabot siya or wala. Okay. Now we have the nursing assessment. So before the surgery is going to be performed to the patient, you need to know all of this one. Okay, can I nasa slide? So first of all, you have the nursing history or the history of the patient. So you need to ask whether na ba siya ay cardiovascular disease, okay, if hypertensive siya or hypotensive, respiratory disease, for example, if na ba siya ay COPD or any other lung diseases, liver diseases, renal diseases, diabetes mellitus, and bleeding disorders as well. Okay? So, very common good na is hypertension and diabetes mellitus. Diba? Those are very common na mga conditions sa patient before the surgery. And then next one we have past surgical history. Okay, it is very important nga makabaluta whether ang patient is niagi na baong mga surgery, whether minor or major. Then pangutanon gina ninyo, kano sila kagi-operahan nato sir? So, kwanto siya mga March 2018. So you need to take note the date, the month, if possible, pwede po ang date, then the year as well. Then allergies, okay. Very important to know nga if allergic ba ang patient sa certain medication. Okay? Like for example, mga pain relievers na for example, ang patient is allergic siya sa like paracetamol or Nubin, mga nabitaw. So you need to take note of that. Then sa ihapong foods as well. If allergic ba siya sa yung seafood, sa eggs, kay na certain medications nga ang yung component is like mga iodine, no? Mga seafood, siguro mga components, we don't know. That's why you need to take note kay basin ka nga tambal allergic sana. Okay? Then next is smoking and alcohol habits. You need to know whether the patient is smoking. So you need to know whether how often siya ga-smoke. Like sa isa ka adlaw, how many cigarettes does he consume? And then how often? And pila na siya ka years ga-smoke. And same gyapon sa alcohol. If ga-consume ang patient of alcohol, then you need to know how many ml or how many glasses a day and how often, like every day ba or 3 times a week lang ba or every weekend lang ba, and for how many years na sad siya gainom og alcohol. They are very important kay they might affect no sa tolerance sa anesthesia. Okay, if your patient is smoking or alcohol or even using drugs, no, mga illicit drugs, then maka-affect na siya sa effect sa anesthesia. So you need a stronger medication, stronger anesthesia in order to put the patient to sleep. So that's why i-take note din ninyo ng smoking and alcohol, and as well as if take bog drugs ang patient. Next, occupation. Of course, no, ma-relate sa nimo if the patient kay nasa, for example, nasa sales industry, okay. Kung na siya sa sales, so kailangan siya mo kota. So, very stressful na siya nga kanang job, no? So, that's why maybe naka-add sad na siya sa condition sa patient. Yeah, we don't know. So, you need to know the occupation of the patient. Next, emotional health. Okay, if she or he is emotionally healthy, or if not, maybe depressed ang patient prior sa surgery. Okay, we don't know. So, you need to take note. And significant other support. If naabay family members or friends or even relatives ng patient before the surgery, kay, you know, you need to explain everything to the patient and to his or her significant others as well, so that na ay emotional support ang patient. And then, patients and significant others understand of surgery. So, if nakasabot ba ang patient and iyahang significant others, nganong kailangan siya mo undergo sa procedure, sa surgery. And then, next one, we have the surgical risk factors. So, we have A and GMM. So, the age. It is very important to know whether the patient is very, very young or very old na. So, if they're very young, they're at risk pa, no? Kay, for example, sa infant or baby, children, dili pa yan naka well-developed ilang body. And then sa elderlies as well, you know, dili na kay na naka-functional pod ang ilang body. So, those two age groups are at risk for mga different complications sa surgery. Next is you have your nutritional status. So if your patient has a healthy BMI or like obese or like if underweight, no? So maka-affect din niya siya sa surgery as well. Then you have your general health. So overall healthy ba ang patient? Then medications as well. So if your patient is taking any certain medications, no? So for example like aspirin. So dapat ipastop na siya like days or weeks before the surgery para di siya at risk of blood loss. And then the mental status of your patient as well. And then, so we have the pre-op assessment. So the physical status classification. You need to identify your patient first if um, he or she is a normally healthy patient. Okay. And then, or the patient has mild systemic disease. Third, if the patient is with severe systemic disease that is not incapacitating. So, dili siya maka-hinder, no? Maka-function pag gidugayon yung patient. Then, fourth is a patient with an incapacitating systemic disease that is a constant threat to life. Okay, so maka-disturb na siya agad sa way of life sa patient. And then fifth one, a moribund patient who is not expected to survive for 24 hours with or without the operation. So, dari na mo insert tong emergent na type of surgery. And then, it must be brief and complete as well. So, in your physical examination, only the important details must be put into your patient data sheet. And then determine the following. So nutritional status, height and weight, the BMI of your patient, the serum protein level, and the nitrogen balance. And also other nga mga blood chemistry sa patient. Uh, ang doctor yun, before surgery, mag-order yun na siya og kanang mga blood chem or yung mga ipalaboratory gina ang patient. It's because the surgeon needs to know whether there is an underlying disease or mga any other conditions that might affect the surgery. Okay? So that's why dapat na ay before and after gyud nga blood chem sa patient. When it says a nutritional and fluid status, so you need to assess for obesity, for weight loss, malnutrition, metabolic abnormalities, and the effects of medications on the nutrition of the patient. And then you need to obtain the BMI and waist circumference as well. And then also you need to take note of the weight good sa patient. Dapat na na siya sa nakasulat siya sa tanan indications nga na ay weight dito sa patient's chart. Because kung obese kay ang patient, maglisod ana ang anesthesiologist ang patulog sa patient. Especially if ang patient is spinal, kanang sa likod bitaw kanay dagom mo itusok para dira iagi ang anesthesia para half sa iyang body is dili wala siya ma-feel. Okay, very difficult na for anesthesiologist. That's why they need more like stronger medications or higher dosages of like medications and anesthesia so that wala gyud ma-feel ang patient during operation. Then the respiratory status. So you need to advise the patient to stop smoking 6 months prior to surgery para dili magka-complicate during the surgery. Na teach breathing and coughing exercises. So before the surgery, dapat matudloan na ang patient on how to do the proper breathing exercises. And then if the patient has respiratory infections, then the surgeon will postpone the surgery and reschedule it. Okay? Kaya dapat maulian pa ni iyang infections before siya ipa-perform sa or ipa-undergone rather sa surgery. Okay? Because if na siya mga sakit betao before the surgery, it might complicate during the surgery and after as well. So that's why, as much as possible, stable ang patient, well ang patient, ay i-perform ang surgery. Okay? Next, cardiovascular status. So if the patient is hypertensive, you postpone the surgery or the doctor will postpone the surgery and reschedule it. Okay? Dili necessary nga postpone gyud din, gid din siya ipa-perform la yun. Or dili na siya i-undergo surgery. So i-postpone lang and then the surgeon will reschedule it. It's because hindi pwede po nga taas kayo ang BP sa patient if operahan siya because that is at risk ang patient ana for mga complications during surgery. Okay? So maybe there is a blood loss, okay, or mag-arrest baka ang patient, simbako lang during surgery. So that is a big no-no. So dapat ipa-stable sa um, iyang BP sa patient, no? The surgeon will coordinate with the IM, internal medicine nga doctor sa patient. So dapat ma-manage siya before the surgery. And then avoid sudden changes in position, like prolonged immobilization as well, hypotension, hypoxia, and overloading of the cardiovascular system. So you instruct the patient to move slowly, especially if ikan siya nagikda, then ipalingkod siya, pabitay lang sa ang tiil, then before siya, ipalakaw. Of course, if makairasad sa patient. The next one, hepatic and renal status. So, optimal liver function is essential. Okay, so that's why there are different laboratory tests to perform prior sa surgery sa patient. And surgery is contraindicated in patients with acute nephritis, acute renal insufficiency, and oliguria or anuria, or other acute renal problems. Okay, so in here, depende na siya sa decision sa surgeon if ipadayon niya ang kanang operation or surgery sa patient. Okay? Endocrine status. So, patients with DM or diabetes mellitus are prone to hypoglycemia and hyperglycemia after the surgery. So, the CBG tests must be performed before, during, and after the surgery. So, mag-order ang doctor, ang surgeon, to perform CBG test. And then the blood glucose must be maintained below 200 milligrams per DL. The use of corticosteroids places the patient at risk of or for adrenal insufficiency. So adrenal insufficiency, so that includes your Addison's disease, which is a disorder that occurs when the adrenal glands don't make enough certain hormones, especially your cortisol. And the patients also with thyroid disorders are at risk for thyrotoxicosis or respiratory failure. So in thyrotoxicosis, so di ba din na it's a condition wherein you have too much thyroid hormone in your body. So when you have thyrotoxicosis, so na mo yung mga signs and symptoms like heat intolerance, mga palpitations, fatigue, weight loss, muscle weakness, no? So those are your mga at risk na mga symptoms if you have thyroid disorders. And then you have your immune status. So you need to determine the presence of all the allergies, document any sensitivity to medications, and past adverse reactions to these agents. So, for example, if a patient is allergic siya sa Nubane, no? Kabalo ang patient nga dili siya gaangay sa Nubane. So, ma'am, pangutanon nimo, ma'am, kanang, sige ka, hitabo sa imong body, ma'am, if natagaan kag Nubane. So, example, mag-rashes siya, galisod siya ginhawa. So, you need to take note all of those adverse reactions. And then, you have to have strict asepsis on immunosuppressed surgical patients. Strict asepsis good kay if immunosuppress ang patients, then magkasamot sila nga ma-prone sa infection. So, previous medication history. So, we have, for example, adrenal corticosteroids. So, do not discontinue abruptly. So, cardiovascular collapse may occur. So, again, this is not your responsibility, but the responsibility of the doctor. But it's very important nga if you encounter these medications, you are aware nga these medications need to be stopped abruptly or weeks or months before the surgery, okay, and what are their effects during surgery or even after surgery. So if diuretics ang medication, so for example, thiazide diuretics may cause excessive respiratory depression. Okay? So dapat ignan niyo ang doktor nga, Dok, gatid di siya ginani nga tambal, Dok, diuretics. So ang anesthesiologist ma-aware nga di kay siya dapat maghatag og larger doses of anesthesia. It's because na possible for respiratory depression ang patient. So maglisod siya ginhawa, then mag-arrest ang patient siya ginhawa. The next, chlorpromazine increases hypotensive effects of the anesthetics. Then next is diazepam, may cause anxiety, tension, and seizure if withdrawn suddenly. And then erythromycin, okay, an antibiotic. So if it is combined with curariform, muscle relaxant, it may cause respiratory paralysis. And then warfarin, so should be discontinued because it has increased risk of bleeding. Then phenylazine sulfate, so increases hypotensive effects of anesthetics. And then we have your levothyroxine sodium, administer IV to keep patient in euthyroid. So when you say euthyroid, normal ra iyahang thyroid function sa iyang lawas. Okay, so again, depende rin sa surgeon kung sa iyang ipahatag ng medications. But at least you need to take note kung say effects sa niyong mga tambal or if naani sila dapat ma-aware ang surgeon. Kay basin dapat na siya ipastop ani nga mga certain medications prior to the surgery. Next, diagnostic screening. So you have your laboratory screening. So again, mga blood chem like CBC, electrolytes, coagulation studies, serum creatinine, BUN, urinalysis, blood typing, and cross matching. Then you have your radiologic screening. So you have your X-ray, MRI, CT scan, and other diagnostics such as your ECG. So depende na sa doctor's order kung unsay ang ipa-perform nga mga diagnostic screening prior to the surgery. Okay, next. Before the surgery, no, dapat tayo informed consent. So, indications of informed consent. So, you have your non-surgical invasive procedures, your anesthesia, radiation, and surgical invasive procedures. Name sa doctor, and ang isa is ang name sa nurse. Okay? Again, ang doctor ang mag-obtain sa consent. Siya ang magpapirma ayon sa consent. Okay? Because that is his or her responsibility as the doctor to explain fully in detail what is going to happen to the patient inside the operating room. Okay? So again, doctor gid ang mag-obtain sa consent, siya yung magpapirma. Then the nurse will be the witness. So dili siya sa pikas magpirma. Okay? Name and signature sa patient or significant others. Then if dili ang patient ang nagpirma, unsay iyang relation sa patient. Okay? And then doctor will sign here sa first blank, and then sa right side will be the witness, which is the nurse. Okay? So that is an example of your anesthesia informed consent. So napana siya sa likod, no. Dito mag-sign ang anesthesiologist and the nurse as well as witness. Okay? Next one. Informed consent should answer these questions. First, what do you plan to do to me? Okay? So dapat na-explain na siya sa surgeon. Then, why do you want to do this procedure? What are the alternatives to this plan? What things should I worry about? And what are the greatest risk or worst that could happen to me? Okay, so dapat na-explain din siya sa surgeon, sa patient. Meaning, independent na sila. So, wala na control ang parents sa ilaha. So, they can sign their own informed consent. But, with this one, this law applies to the other countries like United States. But here in the Philippines, um, a parent or legal guardian must sign the informed consent. The next one, a minor who is the parent of infant or child who is having the procedure, he or she may sign for the child. Okay, so if ang patient gani is, for example, a baby, no, then iyahang parents are still minor, like below 18 years old, so they have the right to sign the informed consent because they are the parents of the child. Okay, then illiterate, he or she may sign with an X, after which the patient writes patient's mark. Okay, so na siya like sa informed consent, ihang mag-sign siya dito or mag-thumb mark dito. Pwede ra na siya. If di siya kasabot, no read, no write ang patient. Okay? And also, if unconscious ang patient, a responsible relative or guardian may sign the consent. Okay? If wala dira ang patient, I mean ang significant other, during that time, especially for example, if ang patient na gid is for ER na gyud, then pwede ra telephone through telephone call. But naapoy dapat nga witness. Example, ang doctor ang nag-story sa patient. So, dapat na ay nurse nga nakadungog sa conversation as witness. Okay? And mentally incapacitated by alcohol or other chemical substance, a responsible relative or guardian may sign when the urgency of the procedure does not allow time for the patient to regain mental competence. Okay? So now what if your patient does not have any, significant others, family members, or even a guardian? For example, kay ang patient kay taga Manila, then yan lang siya diri sa Cagayan de Oro for leisure or business trip, then wala siya lain kauban, and then na-disgrasya siya. So, who will sign the informed consent? So, let us read this one, alright, to inform consent. This is based from the DOH, na itong patient's right, 13 patient's right. So, according to that statement from the DOH, so in emergency cases, when the patient is at imminent risk of physical injury, decline of death, if treatment is withheld or postponed. So in such cases, the physician can't perform any diagnostic or treatment procedure as good practice of medicine dictates without such consent. Okay? So, naara sa doctor if wala gilain nga mapangayon og consent, then naara sa doctor no kung i-perform niya ang surgery sa patient or dili. Okay? Then the informed consent shall be obtained from a patient concerned if he or she is of legal age and of sound mind. In case the patient is incapable of giving consent and a third-party consent is required. Okay? So, for example, ang patient is na yung mga mental disorder. So, a third party consent is required instead sa patient. So, the following persons in order of priority stated hereunder may give consent. First, good is ang spouse sa patient. Next, the son or daughter of legal age. Then the third rank is either parents, mother or father. Then the fourth one is brother or sister of legal age, or the last one is the guardian. Okay, then after sa guardian, kung wala na gini sila tanan din then maybe close friends, best friend, okay? So muna siyang hierarchy sa kinsay dapat gid ang priority nga maghatag sa consent. Okay? Next one, we have the nutrition and hydration. So diet orders, NPO 6 to 12 hours prior to OR. Okay, so usually ana mga 8 hours before OR, dapat naka-NPO na siya. So that's why gabi pa lang ana, no, like before matulog ang patient, instruct na siya nga, ma'am, pag NPO na, kung alas 8 iyang operation sa patient, no? So dapat by 12 midnight, i-instruct nga ang patient nga, ma'am, hindi na ka pwede magkaon og anything, hindi na pwede ka pwede mo inom og any liquids, ma'am. Dapat wala na gid kay kanon og imnon. Sugod karon alas 12, taman og alas 8 sa buntag before ka ihatod sa operating room. Okay? And then monitor the input and output of the patient as well. Dapat i-chart gina siya. Okay, pila iyahang input like sa fluids, sa kanang yang IVs, yung mga medications, then pila po diyang output like iyahang urine or yung vomitus if naa. Okay, ang pila po if, for example, na diarrhea ang patient, so mo ipabana-bana ang patient tong sa kadaghan niya na excrete. Then elimination, so catheter insertion and bowel preparation as well. Like for example, enema or the use of laxatives. So depende na sa surgeon if magpagamit pa siya ni. But usually good, if wala pa naka-catheter ang patient before sa OR, then dito na siya i-perform sa OR. But if nalaga niya naka-catheter na ang patient sa before sa prior to OR, then much better. Okay? Next, rest and sleep. So, first and foremost, dapat good hygiene ng patient. No, if well ra ang patient, kung makaligo ra siya, kung makabath ra siya, then yun sakto mga maligo before the surgery. Okay? Kay, if wala siya naligo pa na baka adlaw during his hospital stay, so medyo unhygienic na kaayo, no? Then prone siya sa infection, so mga inana, good. So, you instruct the patient nga, ma'am, if makaya ra, pwede ra ka maligo before ka ipato sa OR. Okay? And manot brush food appeal. Very important. And also, remove cosmetics and nail polish as well. Okay, depende na siya sa hospital policy, no? But I think sa Philippines, inani pa man din pa-remove gid ang cosmetics and also yun, the nail polish. It's because, for example, if naka-lipstick ang patient o if nakapot siya nail polish, then di ba indicator nga ga-hypoxia ang patient is kanang mag-bluish discoloration sa lips. Di ba mag-pale or mag-bluish discoloration appears sa siyahang lips and siyahang nails. That's why ginatanggal gina siya para ma-check gid tanan if okay ra ba ang patient. But sa US, no, as we can see sa mga videos online, so okay ra nga naka-makeup or nail polish. So depende ra na nila, no. So but sa hospital policy na to ato lang i-follow sa ilahang advice, sa ilahang protocol. And then remove all hairpins and clips. Okay, so para dili na siya ma-add to sa surgical site to also to minimize the risk of infection. Remove dentures. So, dapat wala na postiso ang patient. Okay? Kaya para ipanganga na sa anesthesiologist ang patient. So, diretso na siya matubuhan if ever. Okay? Then, para po dili mabuak yung postiso. Then, provide an OR gown. So, dapat before ihatod sa OR ang patient, nakasuot na siya og OR gown. So next is psychosocial preparation for surgery. So you need to reduce the anxiety and fear of your patient. So in order to do that, you need to promote positive coping strategies. Like you instruct them to watch TV, to listen to the music, or to roam around sa inyong hospital garden if naa, okay? Para lang ma-distract siya, para di siya magunaw na nga, uy, na di siya surgery ugma. You know, thinking of surgery is very stressful to the patient. So that's why, as much as possible, ma-reduce yung anxiety and fear by instructing them to do some nursing interventions. Okay? And you provide preoperative teaching, provide opportunity for visits from family and friends as well. Then, again, you instruct them, pag may stress sila, instruct them to do deep breathing exercises. Okay? So during pre-op teaching, you will have your lung exercises sa patient, okay? So you instruct them to do deep breathing exercises, coughing exercises, and teach them how to use the incentive spirometry. First on the list is your diaphragmatic breathing. Okay, so diaphragmatic breathing or belly breathing, another term, involves fully engaging the stomach and abdominal muscles and the diaphragm when breathing. This means you actively pulling the diaphragm down, okay, pa down with each inward breath. So in this way, diaphragmatic breathing helps the lung feels more efficiently. So dali ra siya mapuno inyong lungs. Next, the coughing exercises. Okay, so you also teach your patients how to cough, do the coughing exercises. And then body exercises as well, like leg exercises, turning to sides, left and right, and getting out of bed exercises. Then you practice, you instruct the patient to exercise with caution, nga dili sila mahulog sa ilahang bed. So we have here like exercises, you have to flex, straighten, and then down. So ina na siya pag leg exercises sa patient. That's a pre-op teaching ha. I-teach na siya before pagid sa day sa surgery. Next, preoperative teaching also involves your foot exercises. Okay, left, right, and then the circular motion. Spiritual preparation for surgery. So respecting the spiritual and religious beliefs of your patient. You need to provide time for prayer, arrange for a visit from a spiritual advisor or clergyman as desired. So if gusto sa patient, no, then take into consideration the religious beliefs in the operative care of the patient. Okay, so kung na siya mga special nga mga request, for example, the mother is for cesarean section, no, then she wants nga only female nga surgical team ang naa. So it is very important that you respect the decision of the patient. Nga dapat female lang gyud ang kanang involved sa operative care sa patient. And now you have your GI tract preparation. Okay, so if na ay special orders inyong surgeon, no, so you need to perform them. First is oral laxative. So if tagaan ba siya, for example, of castor oil or dulcolax, please you need to have presence of mind. No dulcolax kay suppository ni siya, meaning ipagi siya sa anus. Dili siya per orem. Okay? So, base na ay maghatag sa inyong dulcolax nga gi painom gid sa patient, gi patumar gid sa patient. So, it's a big no-no. Then, clear liquid diet in the evening before surgery. Then, the patient should be on NPO after midnight. Multiple position. So, tap water enemas the evening before the surgery. And then, oral antibiotics 4 hours before the surgery. Okay, so depende na po na siya if unsay oras nga ipahatag sa surgeon. Okay, so you need to ask them. Next, skin preparation. So, cleaning the skin over the surgical site with antimicrobial solution. Okay. So, skin prep usually sa OR naman yung ginahimo, no? But there are some mga special instruction or special orders sa surgeon nga dapat gid i-perform before the procedure. So, the very common solution is the betadine. So, muna siyang ginapalimpyo yun sa surgical site. Then, removing hair over the surgical site. So, if na ay hairs or hairy kayo ang patient sa surgical site, so, you need to shave the hair or clip the hair. So, di ba based sa inyong Asian hospital nga an online session kay dili na sila ga-shave instead nga ga-clip na sila sa hair. It's because shaving causes kanang injury sa skin sa patient, no? So I mo po na mo notice before nga if mag-shave me sa hair sa patient medyo mag-reddish siya. So meaning na injured na patient ato it's because hait kay ang blade sa shave. Okay? So that's why clipping na to ang Asian hospital. But again, depende po din sa availability sa inyong hospital and sa inyong hospital protocol. Next, apply antimicrobial solution to the skin over the surgical site. So again, betadine solution is a very common one. Okay, so pre-op medications. So the reasons for pre-op medications are to reduce anxiety, promote relaxation, reduce pharyngeal secretions, prevent laryngospasm, inhibit gastric secretions, and to decrease the amount of anesthetic required for induction and maintenance of anesthesia. Okay, so those are the reasons for your pre-op medications. So you have the different types of medication categories. So first is the sedatives and hypnotics. So very common are the Nembutal, secobarbital. Okay, so those are examples of your sedatives and hypnotics. So i-sedate niya ang patient. Next, tranquilizers. So you have your Valium, Vistaril, Thorazine. Those are examples of your tranquilizers. Then opioid analgesics, your pain relievers. For example, is Demerol and your morphine sulfate and your dilaudid. Okay, but morphine is commonly used. Then we have the anticholinergics. So, for example, it's your atropine sulfate and hyoscine. Next one, your H2 receptor antagonist. So, you have your cimetidine, ranitidine, famotidine, mga din-din, DINA nga mga medications. Then lastly, your antiemetics para di magsuka ang patient, no? You have your metoclopramide, droperidol, and promethazine. So that's it for your pre-op medications. So they are acronym as SHOTA or SHOTA, SHOTA. Okay. So those are your pre-op medications. Okay, so preparation on the day of the surgery. First and foremost, so you need to provide bath and mouth care to your patient. Okay, so you need to like instruct them nga if kaya ra nila silang kaugalingon, then ipaligo sila, then ipa-toothbrush as well. And then provide a clean gown. Remove hairpins, and then you instruct them to braid long hair if kaya nila, and cover the hair with a cap. Next is to remove the dentures, foreign materials, colored nail polish, hearing aids, glasses, and contact lenses. Okay. Then take baseline vital signs before giving pre-op medications. That's very important. Check the ID band if it is the correct patient. Then also you need to let the patient state his or her name. Then check for any special orders. For example, if na enema, gastric tubings, IV lines, or even catheter. Have the client void before pre-op medication. So, ipahihi sa ang patient before giving the pre-op medications. Then, continue to support emotionally and to accomplish the preoperative checklist. Okay, transporting the patient to the surgical area onto the operating room. So you need to have provision of comfortable stretcher, provision of sufficient blankets para di kita ng patient kis tugno ra ba sa operating room. Provision of safety measures, proper identification of surgical patient, proper greeting of patient, and provision of a quiet environment para dili ma-stress inyong patient if ever saba kayong sulod sa inyong operating room. So now we have the preoperative checklist. So, dapat na informed consent na sign na sa patient, sa doctor, and sa witness na nurse. Surgeon, nurse conference. So, dapat, especially for the nurses, no, kabalo na sila kinsay scrub nurse, kinsay circulating nurse na mag-assist, kinsay name good sa complete name sa doctor is like, for example, sa surgeon, and then if na by first assist ang surgeon, and also your anesthesiologist as well. Then laboratory test, skin preparation, the betadine, then bowel preparation, if na-enema ba or natagan ba collapse ng patient. IV fluids as well, if correct ba nga IV fluids ang order, o nasa doctor's order before transporting the patient inside the operating room. Then, nahatagan ba siya pre-op medication, sedations, and antibiotics as well. Removal of dentures, nail polish, and jewelry release. And the patient should be on NPO status. Okay, so nayuban patient no nga gahi kay gulo nga mainom gyud. For example, natoy incident na mo before nga nakainom niinom gyud ang patient kay giuhaw gyud siya. Nga gi-instructa naman gyud siya nga di na gyud siya pwede mo inom ug mukaon. So, may po dito siya no. So, medyo na-delay po ang surgery nga may gi-extend na lang sa doctor para gyud dili gyud maon sa patient during the surgery. Okay, so this is an example of your preoperative checklist that we have obtained from our previous workplace. So we have here the patient's detail, no? So the patient's name, age, sex, room number, the date, weight, the height, religion, case number. So based na siya sa inyong hospital, no? Then you have the complete name of the surgeon, the assistant surgeon, the anesthesiologist, and the name of the procedure as well. So you have here the instructions to be accomplished by the nurse in charge of the patient. So yung charge nurse. Check the items adequately carried out. Must be properly signed and placed in the chart on the first page. Before gyud isulod ng patient sa OR, so dapat kining pre-op checklist nakabutang na siya sa pinaka first page sa inyong chart. Then ahead and iyahang information sheet sa patient. Okay? So we have here the task to do. So first and foremost is the consent for operation must be accomplished. Okay, so dapat napirmahan na. The floor nurse is your charge nurse. The OR nurse, sama mo good before, lahi ang floor nurse is the charge nurse kanan sa ward. Siya mag-check ani kung na-accomplish ba niya yung dapat ma-accomplish. And then we have the OR nurse. Okay, so ang circulating nurse dapat ani pod ang mag-perform sa pre-op checklist before masunod ang patient sa operating room. So, consent, dapat na-sign na history and physical exam of patient. So, dapat na-perform isa ni siya. Okay, so if done na, then i-check. Cover or chart cover properly marked for allergies. Okay, so dapat if na special notation ang patient, no, if na siya allergic ang patient, for example, for certain medications like Nobain, so dapat nakabutang na siya sa chart, sa cover gid sa chart. Like, murag na ay color dito nga paper, then i-tape na dito sa gawas gid sa cover sa chart. So that ma-aware ang tanan doctors, ang medical team, ang mga nurses, na may certain medication nga allergic na ang patient ani. Bawal siya matagaan kay basin ma-at risk ang patient if given that medication. Then you have the patient ID band. Okay, so dapat suot na sa patient, no? Then history and physical exam sa patient. So if na ba siya asthma, hypertension, or diabetes. If na siya na, then check na siya. If wala, then i-mark X. Previous operation done and date. So kung na siya previous operation, dapat ibutang diya sa itong operation. Okay? And then say date ato. Next, chart cover properly marked for allergies. Okay, so sa itong tambal, for example, na siya allergy dadto, then say ang reaction na nga allergy. Okay, so if garashes ba ang patient or gilisod ba siya ginhawa, so that must be taken down note. Next, the laboratory reports. Okay, so if na ba siya routine blood, mga blood chem, so dapat if nakuha na siya, then i-mark check. If na siya urinalysis, if na ay radiologic report or films, like mga x-ray films. And then cross-matching and typing if for blood transfusion ang patient. So if wala ra gani, dili ra siya applicable, then butang siya dinhi sa kilid NA. Next, number 8, so CP cleared by doctor. So CP means cardiopulmonary clearance. So cleared ra siya sa iyang cardiologist and pulmonologist. Okay. Kani siya applicable siya sa patients who are elderly and mga child, mga bata, or mga minors as well. Okay? So, when CP cleared by doctor, so ibutan din niya doctor. Kung cardiologist kani, ibutan din niya ang name. If na po, separate po diyang pulmonologist, then ibutan po din niya ang name. IV fluid. Okay, so sa nga fluid din for example, plain NSS 1 liter. Say regulation at 20 drops per minute. Say gauge. So gauge, for example, gauge 20. And site. Say site, right ba or left? Okay? Right right hand, left hand, and okay, so say side. Next is the antibiotic given. So, say name sa antibiotic, spray dosage, and say time gihatag. Number 11, last fluid intake. So, you write the date, time, and it's either AM ba or PM. Then, same gapon, last liquid intake. Number 12, dentures remove. So, nagsaka na ba ninyo yung patient nga kwaon niya iyahang dentures? Then we have hair prepared, hairpins removed, facial cosmetics removed, jewelries and accessories removed, nail polish removed, patient made to void or with FBC. Kung wala siya FBC, din ipa-void ang patient ni ipaihira siya iyang kaugalingon. Or if with Foley bag catheter, then ibutang din ni with FBC. Okay? Personal hygiene, so oral care, preoperative bath, okay? Then preoperative gown on, then spiritual care, so confession, communion, and anointing, if na ay spiritual care, nagpatawag og pari, no, sa patient. Then pre-op orders carried out. So of course, dapat naka-check ni siya kay dapat indication ni siya nga na carry out ninyo ang order sa doctor. Then you have your vital signs prior to or before good ipa-hatod ang patient sa OR. So na diri ang BP, pulse, respirant, then autosat, and temperature as well. Okay? Then, due medications. For example, nasa sa ward, diba? So, na siya yung mga routine nga mga medications nga mag-due gyud. For example, 8 a.m. yung medication. 8 a.m. yung operation. Then, na siya alas 10 nga tambal. So, dapat ibutang din na siya naka-schedule nga 10 a.m. medication. Okay? 10 a.m. medication. Then, unsa na siya nga medication, unsay dosage, okay? Unsay route, ana. Then, special endorsements, if naamang gani. Okay? So, you write it here. So, name and signature of the station nurse. The name and signature of the OR nurse. Okay, separate man sila mag-perform sa preoperative checklist. So, that's it for the perioperative phase. So, if you have any questions, please do not hesitate to ask. Or if you have any concerns, so you may comment in this post together with the video. Thank you.